Walk into the Vanderbilt Eye Institute and you're likely to see Sean Donahue juggling many roles. And the consensus is he's better at juggling those roles than he is at actually juggling.
Sean's one of those rare, we call triple threats. The people that are outstanding clinicians, are really talented investigators, and are also good teachers. They're rare, and he's one of them. He's one of the best.
Sean's the most diversely talented person I think I've ever met.
He is an excellent scholar, an excellent researcher, an excellent physician, wonderful surgeon, and a compassionate heart. He's got the whole thing.
A 1984 graduate of the University of Dayton, Sean Donahue has expertise in both pediatric ophthalmology and neuro-ophthalmology. He is a vice chair of the Vanderbilt Eye Institute and the clinical director, where he oversees 125,000 patient visits annually. He's also the Coleman Endowed Chair in Ophthalmology, teaches residents and fellows, and has a leadership role on university committees. His reputation in the field of ophthalmology goes far beyond Vanderbilt University.
Oh, he has an international reputation. He's led some of the major programs across this country in eye disease, in the prevention of eye disease for young children. His CV, his resume is 100 pages long. He's published in every major journal.
He's the top of his field. He's clearly one of the superstars in pediatric ophthalmology.
He's a major thought leader. He's introduced a variety of concepts on how to reach out and into communities and care for children. He's just excellent in every possible way.
Sean's leadership in developing screening programs for young children has had a profound impact on early diagnosis of eye problems that can lead to visual impairment if untreated.
It's about detecting the problems early.
Early ages, kids can't read. They can't communicate very well. They can't tell you they don't see very well out of one of the eyes.
You can't see these problems, you can't detect them, but yet they're causing a problem with the developing visual system. So the idea was to find something that was new to be able to detect these children at a younger age when treatment can be brought on earlier and can be more successful.
Sean evaluated the effectiveness of various emerging technologies that could be used in pediatricians' offices. He worked with manufacturers to improve the product, and he worked with physicians and policymakers to drive acceptance and adoption of the early detection technology.
If by the time I finish my career, automated vision screening can be an integral part of every pediatrician's office and be a part of every child's eye exam so we can detect these children before their vision loss becomes permanent, I think I'll have done my job.
Because of Sean's research and his work with Lions Club volunteers, the early screening is making an impact, both in the United States and around the world.
Just think about the fact that there have already been several million children screened, and so the amount of vision loss that's been prevented by this is really extraordinary.
Sean credits the University of Dayton for giving him the confidence to reach his potential.
The University of Dayton came around for me at what I thought was a very crucial point in my life. I didn't know what I wanted to do, and I was pretty intimidated about going to school with all these big city kids, and I was really afraid that I would struggle. And so the University of Dayton was a very vibrant community where I got to interact with a number of the professors who took me under their wing and helped me and mentored me and really gave me the confidence that I could do some of these things.
Sean's community activity includes many years volunteering with the Boy Scouts, which allowed him to share time with his 4 sons.
What he's done to affect thousands of kids, not just medicine, but in our Boy Scout troop alone, he's affected several hundred boys. We have 3 great duties. We have duty to God, duty to country, and duty to other people. And I think he's done that better than anybody I know. So I mean, he's just a great example of what we all should try to strive to be.
He is a brilliant scientist, a great physician, a great dad and family member, an athlete, just a good community leader. So many talents. He's 100% at everything he does.
He is so ambitious. This is a guy who no moss grows under his feet. He is always going, always doing something.
He sets high standards for himself and then constantly pushes himself to exceed those. And I think we see that across his life.